We're in part 4 of skeletal tissues, particularly looking at now bone growth on page 184, 185. And we have two different, features here of bone growth. There's the type of bone growth applied to long bones that is referred to as endochondral ossification of the long bone. Then we have another figure here in which we're looking at flat bones, and it specifically is referenced as intramembranous ossification, which is typical of the skull bones, particularly those of you that may be OB-GYN nurses or nurse midwives, that you might discover the crowning of the head of the fetus is basically you're looking at a membrane, and you're looking at fluid immediately beneath the skin and the membrane of the bone itself. The bone is not ossified in the region of the posterior fontanelle, which is presenting through the tissues that are opening at the effacement for the uterine cervix. So take a look at this, and we're going to begin here with this presentation here. The skeleton is pretty much just cartilage early on in life during fetal development, and only very slowly does ossification occur. So, and they're not giving us a specific timeline here, I'm noticing. So there are certain bones that present with ossification at certain times. We're born without wrist bones ossified, right? So the wrist is just a series of cartilaginous little areas of primary ossification. So, and as they ossify, then become calcified, then you can actually age someone based on which bones are present or have not yet ossified. So here we have a situation where we have a primary ossification center, we have a little bone collar, we have the cells necessary to proceed, which are the osteoblasts, and we have hyaline cartilage. Hyaline cartilage is going to become mineralized, and that's what's going on here. You'll notice that we're actually forming an area in the middle, an opening area in the middle, and we're going to be then observing the presence of an artery. Basically, this is a nutrient vessel that's penetrating in and supplying blood to the interior of the developing bone. Okay, so then we still have the bone collar here, and as you can see, we have the cartilage here becoming ossified slowly. Then we have secondary growth sites here. This is the secondary growth site at this end of the bone. There's a secondary at this end of the bone. So do you see that we have ultimately three growth sites? We have a primary and two secondaries. The secondaries are at the epiphyses. Okay, and again we have a nutrient vessel supplying the stem cells at the secondary growth site. Okay, and then we finally have ossification occurring now at the secondary growth sites. We have cancellous or spongy bone developing up here and up here. And in the central region, we have this open medullary region. Okay, and we continue to have, now this is for the lengthening of the bone, we have a disc. This is not a plate, it's a disc. We refer to it as a plate when it fully ossifies as bone matrix, but as long as it's cartilage, we refer to it as a cartilaginous disc. Okay, so it's important to have that nomenclature fixed in your brain. Okay, eventually the bone will lengthen, and the disc will basically become ossified. Okay, then now we're going to move on to what's referred to here as intramembranal. Where are we here? Intramembranous ossification. And we're beginning with this diagram here where we have basically this in this first one. Do you see that we have this fairly fluid looking tissue through here with just a few osteoblasts ready to go. Okay, so these are the stem cells, and these are the actively dividing cells with mitotic figures presenting, and we're sort of in this sort of fluid matrix at first. Then we lay down the bone matrix here. There's a few cells getting caught in the matrix. They become what we would call osteocytes. Okay, but we have a continuous, how would I say, a ring of osteoblasts all the way around. Okay, so here's our terminology right here, osteoblast. Okay, so then here we're forming the matrix. Here we're actually starting to observe the presence of nutrient vessels penetrating through. We have the spongy bone forming, and we're developing an endothelial lining where there's going to be stem cells of all kinds of for the bone marrow. Okay, and then we're having this outer layer now of compact bone and an inner layer of what's referred to as the diploi, or the spongy bone. Okay, so and in fact it functions like a sandwich at this point, where we have two layers of compact bone on the outside and this layer of spongy bone on the inside, and we continue to have nutrient vessels penetrating through. And as you can see, the outer area here is lined with osteoblasts. Okay, so we have this continuous sort of laying down and developing of the matrix. Here's the terminology. I don't know exactly how to pronounce that. I pronounce it, or my professors do, as diploi, spongy bone. And we have this, then that's sort of like the middle of the sandwich, and the outer two sides of the sandwich are compact bone. And that completes that process.